All right, guys, what is up? Back for another episode of Tuesdays with Taylor, episode number 18. Thanks for coming along on the ride today. So today we're going to talk about why I think we should be your first stop if you're having pain, and not just back pain, any type of pain. So one of the things that makes us kind of unique as a chiropractor is that we're a primary care physician in the state of Missouri. That means that we can order imaging, we can run labs, we can make you a referral to a specialist too, without kind of having to get lost in the zoo that is the medical field, right? So the healthcare industry is just kind of a zoo. It pushes you here, it pushes you there, and you kind of feel lost sometimes. So our goal is to have an answer for you, whether that's in this office right here, or whether that's with your medical doctor, that's with an orthopedist, a neurologist, anything it might be. We're able to write those referrals. The other thing with that too is that we treat more than just back. So the biggest thing that I hear in this room all the time is someone may come into me with a little bit of low back pain. We resolve their low back pain and they say, oh man, my shoulder's been kind of bothering me, and we can help them with shoulder pain. And they say, I never would have guessed that you could help with shoulder pain. Or just this week we were having, one of my favorite patients was doing press-ups. So it's a little exercise that we do. She said, oh man, my thumb's kind of bothering me. So I asked her about it. It had been bothering her for several years. So a couple treatments, a little bit of manual therapy, a little laser, and she got way better with her thumb. She's able to lift weights now. She's able to do a lot more. So that's kind of my argument for you is to, hey, if you have a little bit of pain and you're not for sure where to start, even if it's something you've been dealing with for your whole life, or you've been saying you have arthritis or DJD or any of these type of labels, come check us out. So here's my kind of argument of how I think kind of the medical industry should work, right? So the first line of treatment, if you have a little bit of pain, should be self-treatment 100%. Maybe you take a couple days off. Maybe you take a little bit of NSAIDs or some anti-inflammatories, or you stretch, or maybe you take a walk, and maybe it gets better the next day. It feels a lot better. Maybe that's not course for intervention. I would argue that it probably is. But then after that, let's say that it just doesn't resolve, or it's just not getting any better. 100%, the guidelines in the latest research says conservative care first, especially for low back pain, but that includes knee pain, all sorts of other stuff like that. And then the last step is other, right? That might be a referral to a specialist. You might need a surgical consult or an orthopedist, or maybe you need some physical therapy along those lines. But to start, we have to exhaust these two first. Number one, that's going to make sure that you get put in the perfect place in the healthcare field. And number two, it's going to make sure that we exhaust all things possible before you go, have a crazy surgery or get exposed to any prescription drugs that may have an interaction for you. So keep this in mind when you're talking about that. I have one story. So there's a crazy study that our intern made me aware of this week, and it was. They basically took images of a ton of knees, osteoarthritic knees with meniscus injuries, and they gave it to orthopedists, which is the knock on orthopedists. It's no big deal at all. But what they did is they basically ranked which ones got better with conservative care and which ones were surgical. And there was a 50-50 chance. In other words, they had a 50-50 shot of looking at your MRI and determining whether or not you need surgery. So again, this comes back to, let's rule out all those things that can be eliminated with conservative care first before you go maybe have a surgery that maybe you didn't need. So hopefully that was food for thought. Thanks again for checking in. Stay tuned for next week. And as always, if you have any questions, comment below, send us an email or a message. And if you have any ideas or things that you're really struggling with, shoot us a message. I'd love to talk about it. So thanks, guys. Have a great day.